I'm on record for sounding the alarm, and I've done it on my podcast. I've done it on other webinars that we talk about the future of precision medicine. And I'm of the mindset when we talk about disparities, the promise of precision medicine is that we can eliminate disparities. If we can systemize patients getting the appropriate tests that inform, downstream care and optimize the right medications at the right time for the right patient, we can really make a dent in health care inequity and outcomes. But on the flip side of that, it can also exacerbate that disparities gap because the medicines of tomorrow will be optimized to those patients who are getting profiled and participating in clinical trials. Does DeciBio look into that sort of perspective when it comes to biomarker testing and disparities that could possibly show up?
And I'm glad that you've been a key voice here, actually, like shedding a light on the fact that disparities actually continue to exist. And you're right that there is always a risk whenever you have one of these disruptive technology that tend to be priced a bit as a premium compared to what exists currently, that is going to actually exacerbate some of these disparities. So I do believe that ultimately, in a long term, it's actually going to be improving the life for everyone. I mean, if you look at the way that a cancer patient, even in the most rural setting in the US, is being treated today versus a billionaire 20 years ago, like the standard of care has still actually improved quite a bit for someone in a rural setting right now. So the goal is obviously to compress that gap and to ultimately eliminate it for everyone to actually get access to the best care. I think that you're right that in the short term, I'm afraid that unless there is very conscious investment and focus on it, is essentially going to increase. But obviously the goal, as I mentioned, is that as AI actually gain traction and it become like easier and easier to actually identify what is the best care for each of these patients, that gap should actually shrink again. So it's my prediction is that in the short term, you're going to be always better off if you're like the top 1 or 10% of payers within the healthcare system in the US. But in the long term, this gap is actually going to shrink.